What it means for a disease to spread through the air. Picture this. The World Health Organization, along with a team of 500 experts, recently joined forces to answer this very question. Their mission was to clear the fog of confusion that hovered during the early days of the COVID-19 pandemic, a time when lack of clarity may have cost lives. From its headquarters in Geneva, the WHO released a technical document, a blueprint of sorts, that outlines this definition. This is a significant stride towards a more comprehensive understanding and prevention of airborne transmission, applicable not just to diseases like measles, but also to the potential threats of future pandemics. Now, let's unpack the term through the air. In this context, it refers to diseases where the primary mode of transmission involves the pathogen traveling or being suspended in the air. This definition seeks to create clarity, much like the term waterborne diseases, which is widely understood by both the general public and the experts. This monumental effort involved nearly 500 experts from a variety of fields, including physicists, public health professionals, and engineers. Interestingly enough, many of these experts had previous disagreements over this very topic. Historically, agencies required substantial evidence before labeling diseases as airborne, which would then trigger strict containment measures. However, with this new definition, factors such as the risk of exposure and the severity of the disease are now taken into consideration. One major point of contention was the classification of infectious particles as either droplets or aerosols based on their size. This new definition, however, shifts the focus from that debate and instead concentrates on how the disease is spread. Reflecting on the early days of the COVID-19 pandemic, there was criticism that the WHO didn't adequately warn about the risks of airborne transmission. Instead, there was a strong emphasis on measures like hand washing. By mid-2020, the WHO acknowledged the evidence of airborne spread, but some argued that this realization came a tad too late. Jeremy Farrar, the current head of the Wellcome Trust charity and former advisor to the British government on pandemics, emphasized the importance of this new definition. He likened it to the evolution of medical practices surrounding blood-borne viruses. Just as gloves became standard practice to prevent the transmission of HIV or hepatitis B, an understanding of airborne transmission will inform practices like ventilation in various settings, from hospitals to schools. In sum, this definition marks a critical leap forward in our understanding and combat of airborne diseases, shaping future responses to pandemics and everyday healthcare practices. In today's video, we explored the new definition for airborne diseases as outlined by the World Health Organization and a team of experts. This definition moves away from focusing on the size of infectious particles and instead concentrates on how the disease spreads. It's a significant step in understanding and combating airborne diseases, and it's expected to shape future responses to pandemics and everyday healthcare practices. In summary, the collaboration between the World Health Organization and 500 experts has yielded a groundbreaking definition for airborne transmission, addressing confusion from the early days of the COVID-19 pandemic. This milestone document from Geneva is a significant stride in comprehending and preventing airborne transmission, not only for existing diseases but also for future pandemic threats. By clarifying the concept of through the air, this definition provides a framework for better communication and understanding among experts and the public. The involvement of diverse experts from various fields underscores the importance of this effort, as it moves away from past debates and focuses on how diseases spread. Looking ahead, this definition will inform crucial practices like ventilation in various settings, ultimately shaping our responses to pandemics and everyday healthcare practices. Stay tuned as we continue to explore and dissect this vital topic.